Creatine is a crucial substance to help promote musculoskeletal health, primarily muscle health. Creatine is vital for energy in adverse environments such as oxygen deprivation or rigorous activity, and has also been shown to demonstrate anti-inflammatory, antioxidant, and potentially anti-acid properties. Creatine is composed of arginine, methionine, and glycine. It's primarily produced in the liver, also produced in the kidneys and pancreas, and the majority of creatine in the body is stored in muscle, kind of underscoring and highlighting the importance of creatine in muscle health. And there's also some deposits found in the brain, suggesting a role for creatine in brain health. Creatine is naturally produced by the body. We produce about 1 gram per day. But most people, if they're living an active or rigorous lifestyle, can expend or excrete up to 3 grams per day. And so there's this mismatch between how much you are producing intrinsically, naturally, and then how much you are expending. Well, the good news for those of you who are carnivores or pescatarians, so if you eat meat or fish, about a pound of beef contains a gram of creatine, and about a pound of salmon contains about a gram of creatine. If you're a vegetarian, then the most of the foods, if not all the foods that you're ingesting or consuming, really aren't a significant source of creatine because creatine is concentrated in animal products. And so if you look at a population of people who are vegetarians, they have lower creatine stores and lower blood values of creatine. So how does creatine enhance, stimulate, promote musculoskeletal health, especially muscle health? The exact mechanism isn't precisely known, but most experts feel that creatine is important to provide the energy during rigorous and intense activity that helps the body create a very strong stimulatory signal to promote repair and growth. For example, during intense activities such as sprinting or lifting or other type of activities, there's an absence of sufficient oxygen to fuel usual activity. So the creatine phosphate energy pathway provides this additional energy. This allows your body to have a very strong signal to initiate growth and repair. And this is likely the primary mechanism that creatine is involved in supporting muscle health. Creatine has also been shown to act as an antioxidant and anti-inflammatory. And this is important, especially in muscle, because muscle is so metabolically active that a lot of free radicals are generated. And these free radicals go ahead and they attack healthy proteins and healthy DNA and healthy fats. And so with sufficient quantities of creatine in the muscle, it helps counteract some of these free radicals and neutralize them. Additionally, scientific findings support the use of creatine to promote and enhance musculoskeletal health. Investigators have shown creatine supplementation helps improve the function of certain individuals who have chronic joint conditions, such as osteoarthritis. The idea being that one of the primary complaints of chronic conditions of joints is weakness and lack of endurance and function. And potentially creatine can help counteract some of these symptoms by improving strength and muscle conditioning. Creatine may help prevent injuries. Research has shown that creatine supplementation decreases the risk of muscle tightness, cramping, dehydration, and overall muscle injury. Research suggests that creatine supplementation during a recovery period from injury helps reduce the amount of atrophy or the loss of muscle mass due to immobilization or lack of use, and also helps people achieve greater strength and function during the rehabilitation process. Creatine may reduce inflammation and muscle damage. Research has shown that creatine supplementation reduces many markers of inflammation and markers of muscle damage. Creatine improves strength, muscle mass, and performance. Creatine supplementation enlarges the pool of creatine available for muscle during any type of activity and allows for a greater effort. This greater effort in turn increases the stimulatory signal that allows for greater gains in mass, strength, and function. An example is being able to do an additional sprint or many additional sprints, or being able to increase the amount of weight you're able to lift during intense exercise. This can lead to greater gains in strength and speed. Creatine can act as an antioxidant. Creatine can directly neutralize the free radicals generated during intense activity in the muscle and help limit the damage to important proteins, fats, and DNA. Research has shown that creatine potentially increases the rate and the efficiency at which the body replenishes complex carbohydrates that were lost during intense activity. Rich natural sources of creatine include tuna, salmon, herring, ostrich, buffalo, bison, turkey breast, chicken breast, and lamb chops. Research suggests that both short-term and long-term creatine supplementation is generally well tolerated, both by young adults and the elderly. There was some concern about kidney toxicity with excessive creatine supplementation. However, the majority of research would suggest that is not the case. But as with any consideration of supplementation, please discuss with a qualified health practitioner familiar with your unique medical history.